Okay, so we need a little reframe here. If your child had asthma or seizures or diabetes, would anyone tell you that the treatment plan is 40 hours of behavioral therapy every week, or maybe 20 hours? They wouldn't do that because they're medical issues, right? Yet that is exactly the kind of logic families are handed every day in autism. We took a generation of children with really complex medical symptoms like gut issues, immune dysfunction, sleep problems, inflammation, sensory overwhelm, and communication challenges. And then we built an entire system, complete with Medicaid and insurance reimbursement, that asks them to perform better, instead of asking why physically or physiologically they might be struggling. And that should bother all of us. Now, I am not against helping children learn skills, and I am not offering a critique of the behavioral therapists who are largely very compassionate and caring individuals. It's just that they were trained to think that this is the best way to support our children with autism. But I am against a model that can ignore biology while also billing by the hour. Now, there's some kids in ABA that see marked improvement in behavior and function, and that's okay, that's great. But many families are never told that there may be underlying biological drivers behind those behaviors. And these things deserve real medical attention. Because what if that meltdown is actually pain? Or what if the inattention, those symptoms of not being able to focus, what if that's actually inflammation? What if the aggression is really just a nervous system that's in total overload, and the child is simply reacting that way because they're stuck in fight or flight? And what if their silence is not a lack of intelligence, but a body whose motor dysfunction is so profound that they cannot coordinate the necessary movements required for speech? You guys, we need a really big vision for autism care, one that's totally different from what we're doing right now, and one that includes behavioral support when useful, but also and first looks at metabolism, mitochondria and energy production, nutrition, gut health, looks at the microbiome, the environment, what's in the child's environment, what's going on with their sleep, really just looks at the whole child. And these families deserve options, because right now the only therapy routinely covered by insurance and Medicaid is ABA, behavioral therapy. So why can't a family who wants to treat their child medically get coverage for what is a more foundational need? Children deserve appropriate and medical care. Their symptoms are not just a part of autism. They're the body's way of telling us that this child is deeply dysregulated. And this truth deserves airtime. We have to talk about this. So I wrote an article that says what many parents already know in their bones, that we need to be treating children with autism for the real medical problems they're experiencing. And I'd love for you to read this article, because I have some suggestions about what we can do about this, and then what kind of solutions there are. Because we need a system that supports parents in their efforts to heal their children's bodies and brains. And we need that now.